Hot News Update Coronavirus on May 9, 2020. Note, this is a collaborative video made between Travel for All fanpage and Knowledge of Coronavirus channel. This video is copyrighted by Travel for All fanpage and Knowledge of Coronavirus channel. Please respectfully welcome everyone. The following is the remarkable news most on May 9 as follows. 1. U.S. News. The U.S. economy actually lost a record 20.5 million jobs in April, marking the biggest job-losing month in the United States. The situation in Canada is also not much brighter, than they have also recorded the second highest unemployment rate in history. The unemployment rate in the U.S. increased to 14.7%, in Canada 13%. According to data on the Worldometer's website, as of May 8 p.m. local time, the number of deaths from COVID-19 in the U.S. increased by more than 1,600 cases the day before, bringing the total number of deaths from this pandemic year more than 78,500 cases. The number of COVID-19 cases in the United States also increased to 27,400, bringing the total number of infected people in the country to more than 1.32 million. Despite the continued rise in the number of COVID-19 cases, U.S. states began to reopen to restore the economy amid tens of millions of job losses. U.S. President Donald Trump said earlier this week that the United States needed to quickly reopen, and this was necessary, though he acknowledged that easing restrictions could make more people sick and died of COVID-19. News from Massachusetts of U.S. Massachusetts has issued guidelines to allow the reopening of private and city golf courses. The city's two golf courses, the William J. Devine Golf Course and the George Wright Course, will open on May 8, 2020. All staff and golfers must wear a face mask and keep social distance from others, at least 6 feet all the time. The statewide homestay order has been extended until May 18, 2020. Necessary businesses will continue to operate. All public and private schools in Massachusetts will be closed for the remainder of the school year. U.S. President Donald Trump confirmed Friday that Vice President Mike Pence's press secretary tested positive, meaning 2 White House staff members are confirmed to have the virus. 2. Update the world. More than 3.9 million new coronavirus cases have been recorded worldwide, including at least 274,000 deaths, according to Johns Hopkins University. According to Worldometer's data, 212 countries and territories today recorded a total of 4,008,110 cases and 275,784 deaths, due to an increase of 92,116 and 5,487 in the past 24 hours, of which 48,648 critical cases, 1,377,123 have recovered. According to Worldometer statistics recorded in the early morning of May 9. 3. Russia News. It has been the 6th consecutive day Russia has increased more than 10,000 cases in 24 hours. Russia is emerging as a new hotspot of the pandemic, as on May 8 it recorded more than 10,000 new COVID-19 cases. This is also the 6th day that the number of additional cases per day in Russia is more than 10,000. According to AFP, Russian government statistics show that the country has increased by 10,669 cases in 24 hours, bringing the total number of known Russian cases to 187,859 cases. There were also 98 more deaths, bringing the total number of deaths to 1,723. 4. Brazilian News. The country which was most affected by the COVID-19 epidemic in Latin America on May 8 announced that it had recorded a record daily death toll of 751. Accordingly, the total number of corona deaths in Brazil has reached nearly 10,000. With 10,222 new cases increased over the past 24 hours, Brazil now has a total of more than 145,000 cases of COVID-19. Even so, experts say these figures do not reflect the true situation of the disease in Brazil. São Paulo is currently the epicenter of the Brazilian pandemic, with nearly 42,000 positive cases and nearly 3,500 deaths as of May 7. Brazil currently has a total of 145,328 cases of COVID-19, including 9,897 deaths. More than 20 presidential officials Jair Bolsonaro have been positive for COVID-19. More than 11 million of the 211 million Brazilians live in cramped slums where experts fear a devastating pandemic. However, in this horrific performance, President Jair Bolsonaro still opposed the closure of businesses, and until this week, the first blockade order was issued in Brazil. 5. Southeast Asia News. Southeast Asia recorded an additional 1,300 people infected and 24 people died from COVID-19, bringing the total number of the whole region to more than 55,000 and 1,800 respectively. Singapore is the region's largest epidemic area, with 21,707 cases and 20 deaths. Indonesia ranked second in the number of cases but leading in the region in terms of deaths, respectively 13,112 and 943. The Philippines is the third largest epidemic area, recording 10,463 people infected with COVID-19 and 696 deaths. 6. Paraguay News. Paraguay President Mario Abdo has expressed concern about the rapid spread of COVID in Brazil and said that this is a major threat to the country. In the announcement, President Mario Abdo said that he was mobilizing more manpower, including mobilizing troops to the most vulnerable areas on the border with Brazil. Meanwhile, Paraguay's Health Minister Julio Mazzolini said he was also concerned about the possibility of spreading the SARS-CoV-2 virus from Paraguayan people returning from Brazil, who were mostly in their youth and had no clear disease. Mazzolini also emphasized the importance of good control of border areas. According to the Paraguay Ministry of Health data, more than half of the 563 cases of COVID infection in Paraguay are immigrants from Brazil. Most of the people with COVID-19 in Paraguay were isolated in military-managed shelters. 7. Egyptian News. Egypt reported that the number of COVID-19 infections in the country continued to increase sharply when there were 495 new cases and 21 deaths despite many preventive measures, bringing the total number of COVID-19 cases in Egypt to 8,476 cases and 503 deaths. In addition, 58 people recovered from their illnesses and were discharged from the hospital, bringing the total number of COVID-19 patients who recovered to 1,945. According to cabinet spokesman Nader Saad, Egypt will have to coexist with COVID-19 starting in June until the North African nation continues its efforts to open the economy after Ramadan. The Egyptian government is hoping to start a new phase on June 1 and will review and evaluate the restrictive measures related to this disease before the Eid al-Fitr holiday season. Starting on May 23. 8 Vietnam News. Bulletin at 6 a.m. on May 9 of the National Steering Committee for Epidemic Prevention COVID-19 said that until now Vietnam has turned to the 23rd. There was no case of COVID-19 infection in the community. There are only more than 14,000 people in quarantine. Vietnam has just handed over 140,000 medical masks and second aid to Japan to combat COVID-19. 9. New strain of coronavirus SARS-CoV-2 does not like high temperatures. According to Russia's Federal Agency for the Protection of Consumer and Human Health, Rospotrebnadzor, Russia, the new SARS-CoV-2 coronavirus prefers high temperatures and almost loses its ability to infect at higher temperatures. 30 degree. Rospotrebnadzor says direct sunlight and humidity are also factors that make COVID-19 weaker. According to Russian authorities, the SARS-CoV-2 virus is completely disabled at temperatures over 70 degrees Celsius. 10. 10 signs remind you to carefully watch your body as well as what to do to protect yourself and your family. 1. Difficulty breathing. Shortness of breath is often not an early symptom of COVID-19 disease, but it is the most serious. Shortness of breath may occur suddenly, not accompanied by cough. If your chest feels tight or begins to feel like you cannot breathe deeply enough to fill the lungs, it is a sign that you need to take immediate action to get immediate medical attention. 2. Fever. Fever is the main sign of COVID-19. According to experts, each person's body temperature is not the same. Some people may have a lower or slightly higher body temperature than the typical body temperature of 37 degrees Celsius, usually up and down many times a day. Most children and adults will not have a fever until the temperature reaches 37.7 degrees C, 100 degrees F. 3. Dry cough. Coughing is another common symptom of COVID-19 disease, but according to TS information, Schaffner, not just coughing. It is not an itch in the throat that causes people to clear their throat. It is not just irritated. A dry cough is really uncomfortable, the cough that an infected person feels in the chest. 4. Chills and body aches. Symptoms usually appear at night. A COVID-19 patient shared body aches, high fever to shivering, even hallucinating. However, not everyone has such serious reactions. Some people with COVID-19 may not have chills or body aches, while there are others who may feel cold like flu infection, fatigue, joint and muscle pain. These are fairly similar symptoms that can make it difficult to accurately determine whether it is influenza or COVID-19. 5. Temporary loss of consciousness. Speaking of signs, when the disease worsens, CDC warns that temporary loss of consciousness or failure to wake up in unconsciousness can be a serious sign requiring urgent care. If these symptoms occur, especially when accompanied by other important signs such as pale lips, shortness of breath or chest pain, seek immediate help. 6. Digestive issues. Initially, diarrhea or other typical stomach illnesses were not considered a symptom often associated with COVID-19 disease. However, some later studies on SARS-CoV-2 positive patients recovered have shown that is incorrect. 7. Red eye. Many studies in countries, including China and South Korea, showed that about 1-3% of people with COVID-19 had conjunctivitis, pink eye. Conjunctivitis is a viral disease and is contagious. SARS-CoV-2 is just one of many viruses that can cause conjunctivitis, so this is not a new finding that will surprise scientists. However, red eyes may be another sign of COVID-19 disease, enough to call a doctor if accompanied by some other symptoms such as fever, cough or shortness of breath. 8. Loss of taste and smell. In mild to moderate COVID-19 infections, loss of smell and taste is one of the most unusual early signs. According to T.S. Sanjay Gupta, these early signs are not classic symptoms. Loss of appetite is sometimes uncertain, but clearly this is a sign not to be missed. Complete or partial odor loss, anosmia, was also detected in SARS-CoV-2 positive patients without other symptoms. 9. Fatigue. For some people, fatigue, exhaustion and body aches may be an early sign of COVID-19 infection. WHO research shows that about 40% of nearly 6,000 people who experience the disease experience fatigue. The state of fatigue can continue after the virus has disappeared. Reports of the recovery phase of patients with COVID-19 show that exhaustion and lack of energy will continue to accompany the patient for a few weeks at the recovery stage. 10. Headache, sore throat, stuffy nose. According to the WHO report, about 14% of the nearly 6,000 cases of COVID-19 in China showed headaches and sore throat, while nearly 5% had nasal congestion. This is not the most common sign of the disease, but it is obviously like a cold and flu. In fact, many of the symptoms of COVID-19 resemble flu, such as headaches, digestive problems, body aches and fatigue. Other symptoms can be like a cold or allergy, like a sore throat and stuffy nose, including a cough and fever. According to a warning from the Centers for Disease Control and Prevention, CDC, one or all of the symptoms can appear anytime between 2 and 14 days after accidental exposure to the coronavirus. New strain SARS-CoV-2. Our newsletter is now over. Thank you for always watching and supporting our videos. Knowledge of coronavirus, channel and travel for all fanpage respectfully, and see you in the next video.